Hello, colleagues. It's such a wonderful moment to meet all of you once again. I can get used to meeting you once a month. I have been very much looking forward to this session today, and thank you so very much for joining me here live. I hope everyone is doing well. I think there's a lot going on in the world. I think if I mention just one or two things, it wouldn't be fair. So there's a lot going on, and I hope while the world is changing, there's a lot of things happening in the world. You're keeping your head up, continuing to inspire people, continue to help people. I understand some of you are psychotherapists, professional coaches, educators, many different backgrounds, medical doctors, and also some of my friends joining in this session. So I welcome all of you to this lecture series, Trauma Informs Love. It's such an honor to have all of you in this space. I have been reflecting a little bit and I thought this is, you're joining here with no obligation. These are all complimentary. There is no mandatory requirement for you to join these things live. Even knowing that these sessions are recorded later, joining live truly demonstrates how committed you are to professional development, also shows how curious you are understanding human transformation. So once again, welcome. Welcome to Ignite Global. Welcome to Evolving Temple. Welcome to Ignite Relationship Studio. Very excited to share some understanding around how does trauma play a role in within ourselves and how do they extend to our loved ones, and also most importantly for those who are practitioners, how trauma play a role in your clients' lives and how can you approach your clients with a deep understanding of trauma. And I'm aware that as some of you are medical doctors and also some of you are clinicians like psychotherapists, so you might find some of this sharing to be a bit basic. The reason being, as many of you are aware, in professional coaching, we don't really delve into trauma. We don't really talk about strong psychological modalities. We don't really look back at the client's world. Therefore, if you're a clinician, you might find some of this information to be basic, but at the same time, I hope you find how we present this information, the perspectives might be interesting. And yeah, so let's dive in. How trauma informs love. Um, I've told you a bit about my life story and I've shared with you how trauma has shaped my life. Every time I think about trauma, the bottom line, what it brings me to is that trauma truly informs love. And today in this session, I look forward to invite you to expand your vision, zoom out and see the bigger picture and see how you find this connotation, how trauma informs love. So, this is the third lecture, and today our discussion is going to continue to evolve around how the unconscious whispers of the past quietly hold us back from our fullest life, our fullest potential. I find the trauma, the traumatic experiences, and the aftermath of it almost is like a invisible whisper in our head, whispering us to like things, not like things, to dislike things, to prefer things, and to be fearful of certain things and to be attracted to certain things. And when I say when there are certain things fearful and attracted to certain things, the interesting thing is that when I say fearful of something, we would imagine it to be something scary. It may be something truly fearful. But the truth is, sometimes in life, we are not only fearful of things that really evoke fear in general sense. Sometimes we know certain things can be beneficial for us, valuable for us, but still we fear them. If you're a practitioner, sometimes marketing, getting your voice out there, and really being able to offer your services, they're very good for us. But sometimes we find ourselves being fearful around them. And at the same time, there are also certain things that we feel attracted to, we feel a draw towards. Usually, when I say we feel attracted and there's a draw towards something, it would mean that thing is good for us. But the interesting thing is, we are not always attracted towards always the good things, positive things, things that serve us. There are also certain things that do not serve us, but somehow we are attracted towards it. In my experiences, I have mentioned many times, that was what the alcohol was, that for me many years ago, right? So it's how we choose, how we love, how we operate, behave, how we like, how we dislike, how we love and how we hate. All of these things are truly inner dynamics, and many of those dynamics are even unconscious, which means quite literally we are not aware how we make choices, how we operate in the world. So those are the unconscious whispers I'm talking about. And in this session today, I look forward to continue to dive deeper and try to surface more understanding of what are these unconscious elements, how are they formed, what does that mean to us as we are speaking about how trauma informs love. So continuing on, I would like to present you with this question. I am aware that many of you are joining both our lecture series. One of them is the how altered states inform love, and this session being how trauma informs love. So, in the previous psychedelic integration lecture series that I'm doing, I asked the same question. How did you come to be who you are? If not, what is your self? I'm not asking you to introduce yourself. This is a different question. If I ask you to introduce yourself, you will tell your name. You will probably say where you live and what kind of work you do, what kind of hobbies you have, something like that. That's not what I'm really asking about. Not an introduction. How did you come to be who you are? How was your sense of self, your ego, what we call your ego? If not, if you look at it from a brain perspective, neurological perspective, how did your default mode network come to be? How did your sense of self was formed? That's the question I'm asking you. And as we continue to engage in this session today, I strongly believe you will arrive at crossroads and truly going inward, potentially even asking some powerful questions. And interestingly, if you may recall, when we had this very first session, one of the questions that came up is, if trauma is so present in our life, adversities are so present in our life, how it is forming us to be who we are. So we have asked this question already. And today we are diving deep into this discussion. So, as usual, this content may include challenging experiences, adversities, trauma, and similar mental conditions. Please engage with caution and make a note. If you have any insights, please feel free to share them through the chat room. And also, if you have any questions, feel free to share them. If the time permits, I'll try to answer them. If not, I'll be sure to incorporate some of your questions into the future sessions where it is most necessary. And also, for the certification registration link will be provided to you by my colleague Lux towards the end of the session. And also, the session is being recorded, as you are aware, and they will become available to you through Awaken Mind Guide, including the slides that I'm using here. All right. So let's, since this has been a month, almost a month, let's do a little quick recap so that we all get to the same speed. So you may recall why trauma-informed coaching. Because when we compare traditional coaching, you notice the operations are present here and now to the future. And I would imagine many of you, if not all of you, you never came to the coaching world, if not your first coach education program or exploring coaching. And I thought, oh, I only want to work with clients here and now to the future. I don't want to work with clients fast. I don't think that any of you really thought it consciously like that. You came into the coaching world, you started learning, and then you realized that, oh, in coaching, I only can work with the clients present into the future. You realize that. And if you may have had the understanding, if you may have had the drive, desire to really work with clients holistically in an integrated manner, this might be a good news for you, because when you are able to incorporate trauma, certain aspects of adversities and trauma responses, how people behave when they have been exposed to difficulties, challenges in life, and how to regulate them, how to interpret them, we are able to make them move forward from the past to present, and from present we can look forward. So this provides us an opportunity to look both forward and then also into our past. This is why I always say, if someone is using traditional coaching framework, if they advertise themselves as holistic, integrated, I think it's not fully true, right? In some areas it may be, but if we do not consider clients' past, focus on current moment and the future, we cannot call ourselves holistic or integrated, because a huge piece, huge part of the client is missing. It's almost like a tree. If you come to think of it, when a tree, what you see as a tree is usually the trunk and then all the branches and other elements of the tree. And if the leaves are falling, if the water supply is right, the sun, the tree is receiving the right amount of sun, you would imagine there might be something with the roots, because we can't just disregard the roots of a tree when we want to treat the tree, or when we want to nurture the tree. We need to look at the roots as well. So if I said we look at the trunk and we look at the branches and the leaves of the tree, that we are encompassing holistically the entire tree, you'll probably you will probably make your eyes like that and then ask me how about the roots, right? So that's exactly what I'm inviting you to think about, the bigger picture. And since this is a recap, you now recall cause of trauma is too much, too fast, too soon. Overwhelming experiences can be considered as trauma, but not only overwhelming experiences. Not enough for too long. Very important human needs. When we miss out, not receiving these human needs for too long, that's deprivation. Deprivation also is a type of trauma. So we look at both sides, overwhelming experiences and also deprivation experiences as well. And we looked at trauma. And this is a very simple example of trauma, overly simplified, I would say. But however, at the same time, what we need to remember is this arrow that we see here, changes to brain, nervous system, and the DNA, that the changes that happen. And those changes show up at a later time, and those changes are unconscious, truly unconscious. Very often, I have had friends, family members who would say, "Isn't that so simple? That person doesn't necessarily need to be negative. They don't have to be nagging. They don't have to always question. Isn't that so easy? Why can't they just do it? They are so perplexed. They are very confused." Well, the thing is, although sometimes we think it is that simple to turn around and be positive, turn around to take actions, not to procrastinate, to come out of a burnout, it's not that easy. If you already have been in a place like that, you already know it's not something that you can think and immediately change. So the reason is that these experiences, these challenges, difficulties we experience in our life are very often unconscious. So very often we are even unaware that's how we behave. And then we looked at few classic trauma responses, very common ones: fight, flight, freeze, and fawn response. And then, if you may recall, so as I'm talking about these traumatic experiences and trauma, it might give you this kind of sense of that they're bad, they're not good, they're painful, they're not serving us. It might give us that kind of feeling. But the truth is, we already have looked at the survivors of Holocaust, for an example, in some of our previous sessions. And you noticed the children of the Holocaust survivors, when there's a trigger, when they feel unsafe, they remain alert longer than someone who has not been exposed to Holocaust. Now, this is not the parent, the ones who were the ones who were really exposed to Holocaust. These are the children. So we are noticing something in our biology changed. And this change enabled the children of the Holocaust to become more alert. So they can get themselves to safety. They can remain alert for a longer time. It might look like painful, but it serves a very important purpose in this case, which is their survival, continuation, consciousness, expression, experiencing, and so on. So if you come to think of it, it is truly a mechanism that is built into these children so they can be alert so that they can continue to survive and continue to experience consciousness. So Again, trauma informs love, the continuation, our desire to continue, our desire to experience, our desire to love, our desire to self express, our desire to experience this universe that we live in. Trauma informs love, it enables us survival. Therefore, we can continue to love the things that we truly love. And then when we talk about stress, now you know that when we look at the trauma-informed world, we are starting to recognize there are stresses, there are adversities, there are also traumatic experiences. Usually the outcome of it are tend to be trauma responses. Now you have an understanding of trauma responses as they are unconscious. And often, when you look at the diagnosis in the medical world, traditional systems, you notice that someone is diagnosed with major depressive disorder, maybe treatment resistant depression, maybe anxiety disorder, social anxiety disorder, maybe complex post traumatic stress disorder, acute stress disorder. There are many different types of diagnoses that are out there. It's worthwhile understanding a little bit what are these diagnoses? How do clinicians make this kind of diagnosis? And beyond the symptoms, what is underneath of these diagnoses? Can they be related to trauma? And that's what we explored during our last session. And we discussed about ASD, we discussed about PTSD, and we discussed about CPTSD, giving you an understanding, although there are clinical criteria which we recognize as the diagnostics. However, they can, once they are clustered and put together, combined together, we call it diagnostic, and then we call it disorder. It's very easy, direct, straightforward process, but it's very symptomatic. If you notice, symptom focused. But very rarely in traditional medical systems or clinical systems, we address what is the root cause. What seems to be underneath of those symptoms? Where did that come from? So, in order for us to gain some kind of an understanding that very often some of the diagnoses that we make are a collection of a cluster of symptoms, and some of these symptoms can be trauma, stressor related outcomes. If not, trauma responses, for an example. So, having some understanding about ASD, PTSD, CPTSD at this stage can be very valuable for you. There are many other stressor related disorders. For now, we focus on the most important ones for us to gain an understanding. And now, continuing on, you also remember that when we talk about trauma responses, these unconscious responses, sometimes without us knowing, manifest through us, do not necessarily need to always be clinically diagnosed. Very often, in fact, clinicians are not really able to make a diagnostic as such because the patients or the clients might not necessarily meet all those symptoms, or they might not demonstrate all of those symptoms. So this is where sometimes a coach can step in. For an example, there's an adaptive zone. Something happened to us, it disturbed us, it's a short-term response, it's temporary. High functioning is it's subclinical level. It is not at the diagnostic level, but at the same time, there are certain challenges and difficulties. And then we have the impaired state, which is the clinical range. So you're starting to already recognize if the client is in the temporary zone, you as a coach might be able to assist the client. If the client is in the high functioning zone, maybe along with another clinician, you could support the client's growth. Of course, if the client has a specific impairment, it's always good to refer the client to a clinician, and under their supervision, guidance, and advice, if they advised you to continue to provide coaching, then you can do that. So you're starting to recognize that very often trauma is stigmatized. Very often we are very fearful about even discussing about trauma. Even sometimes when I look at certain accreditation bodies, they really shy away from it. They run away from it. And also sometimes I hear coaches, even professional coaches saying, "Oh, I don't want to deal with trauma. I don't want to this. I don't want to do that." It's almost like there's a fear towards addressing trauma. I think we fear things that we don't know. I think that's what's happening in trauma. And that's why this effort, complimentary one full year of 12 lecture series, enabling us to not be fearful about trauma, recognize how powerful the awareness of trauma can be, understanding our role well, understanding the boundaries well. And that's the reason why we are doing this. In any way, I would never ever encourage you to cross the clinical boundary, do something in the place of coaching which might cross a boundary and harm the client. This awareness is going to support you, help you to understand what are your boundaries, how to remain within your boundaries, how to make your impact, how to widen your impact and transformation for your clients. And that's why I introduced comprehensive trauma-informed coaching competency framework. And now you're very much aware of this. You know that this competency framework is created in adjacent to ICF core competency framework, enabling the standard, if not the golden standard of coaching, to be aligned with trauma-informed competency. So it's easy for all of us to digest and understand. So there are several different types of, there are different set of trauma-informed coaching competencies. We keep in mind that the foundation is still ICF core competency. So what you see in this competency framework is truly trauma-focused competency. We do not discuss any of the core competency. The only difference you notice here is that ICF core competency has 8 competencies and CTICC framework has 9 competencies. The reason being the knowledge, foundational knowledge of trauma and trauma-related disorders are not something that we come across within coaching and education. Just like what we have done with ASD, PTSD, CPTSD, it's truly important to understand a wider human behavior, neuroscience, and psychology when it comes to working with clients at a depth. Therefore, we have this additional competency, which is foundational knowledge of trauma and trauma-related disorders. Now, speaking of this robust comprehensive framework, as you would imagine, it's not something that I can teach within an 18 hours, within these 12 sessions. Therefore, what I have done is picked up some specific competency and took the specific subcompetency and elaborated it further. So for an example, if you look at the ICF core competency, cultivates trust and safety. And here, when we translate it into CTICC framework, you understand, cultivating trust and safety in a trauma-sensitive manner. When clients talk about trauma, very often as professional coaches, we don't even hear them because we don't know what to listen to. We are unaware. But here, when you have a hearing which is in tune with trauma sensitivity, you end up hearing things that usually professional coaches who follow traditional competency frameworks miss out. So today's session is built upon the subcompetency 4.5, trauma-informed psychoeducation. Offers information on trauma responses, triggers, and aftermath of trauma to help clients understand and normalize their experiences. Now, if we are going to offer that information to clients, it's important that we are aware of this information to begin with. So let's become aware. That's the focus today. Now, when I say offers information on trauma responses, triggers, and aftermath, it doesn't mean that within a coaching session, you start teaching the client. You don't say, oh, this is the phone response. This is hypervigilant. Not really. We also, like in ICF team coaching competencies, trauma-informed coaching competencies also could use a directive approach. And there's a specific model that we use to offer this information, which we will discuss in an upcoming session. So right now, today, what we are trying to do is gaining an awareness of trauma-informed psychoeducation. What do we need to know about trauma before we work with our clients? You also have come to learn that when we look at the stressor-related conditions and disorders, we can look at 3 key categories: the stress itself, adversity, and trauma. We know adversity and trauma create stress in many different ways. So let's continue on to how the unconscious whispers from the past quietly hold us back from our fullest life, the part 2. and the lecture 3. So let's dive in. We dive in with the same question one more time. I remind you, how did you come to be who you are? How was your sense of self formed? That's the question we are addressing today as we learn about trauma informed psychoeducation. And during last session, the bottom line, the last slide told us that we are going to further explore about different types of trauma responses. You notice that there are many different types of trauma responses, and they are also classified in many different ways. However, before we really understand about trauma responses, having some understanding about classifications of trauma is important. So I have a set of comprehensive slides. I will address some of them quickly within the time that we have here. So within this conversation, we will be addressing the type of classifications of trauma. So nature of exposure patterns, how we categorize trauma based on relational and attachment context. How do we look at trauma from a developmental timing context? How about trauma that is generated through social, collective, and environmental scope? And also, um, what is the content type, event type of trauma, and some other special classifications? Now, let's dive in. Now, let's begin with understanding the exposure patterns. There are many different exposure patterns. Exposure, as in, how did the trauma happen? Where were you? Did the trauma happen to you directly? And what was the severity of trauma? And was it just one trauma or many different things happening to you? Several different things can play a role here. So let's have a look. Acute trauma, chronic trauma, complex trauma, developmental trauma, shock trauma, subtle accumulated trauma. Those are some of the things that I listed out for you today. You're already aware of acute trauma. It's once off moment. It's intense, one off event. And you might remember this could be it might end up developing ASD, acute stress disorder, or PTSD because it's one thing that happened, acute. It's spontaneous, just happened. And chronic trauma, repeated and prolonged exposure, highly stressful and dangerous events. And you know that this is the type of trauma that leans towards CPTSD, complex PTSD. And earlier, maybe before you started this lecture series, you might have thought when we say trauma responses, it's the anxiety, it's the kind of fight flight response, maybe it's people pleasing behavior. Those are the outcomes of trauma. But the more in depth you look at trauma, you're learning, those are just only symptoms, those are only just the manifestations of it. And when we have been exposed to severe trauma and it has affected us, chronic, complex trauma, several trauma, you notice that what it really affects is our identity, our personality, our sense of self. And if you look at developmental trauma, so we will dive into developmental trauma a little bit, all the way from earlyhood child, even sometimes during pregnancy. What happens to your mother happens to you, quite literally. Therefore, you carry what happened to your mother as a response within you, and you carry your mother's responses. And then there's a time that you were a young baby, and if you may have been exposed to challenging, adverse experiences, you might not even know that you're carrying them with you. Sometimes people, especially clients, patients I work with, sometimes they tell me, I have this challenge, I have no idea where it is coming from. I have no idea why this specific area is so challenging for me. It's because they might not be able to relate where it might be coming from. Maybe to begin with, they don't even remember. Shock trauma, a sudden overwhelming event. Subtle accumulated trauma, like micro wounds. We discuss this through deprivation, chronic invalidation, criticism, exclusion, not meeting basic needs, and so on. So these are types of trauma that is classified based on exposure patterns, how we were exposed, for how long were we exposed, how intense the exposure is, and so on. And then we continue on to understand the relational and the attachment context trauma. And it's so interesting to me that it doesn't matter how successful the person is, whether they are a millionaire, whether they are a billionaire. It doesn't matter whether they are a clerk, whether they are a senior executive, or whether they are the owner, founder of a multinational company with 10,000 employees. It doesn't matter whether they are clergy. It doesn't matter whether they are an artist. It doesn't matter whether they are a yoga teacher or whether they are an energy healer. Do you believe it if I say that everyone has some degree of relational and attachment trauma? I'm not afraid to say that. First, it's obvious as you look at the literature, as you understand the dynamics. Second of all, the most important, compelling reason why I say this confidently is my experience. Thousands of clients I have worked with, no matter their position, no matter who they are, when we go deep, when we start exploring layers and layers and layers, very often they say, I didn't have any problems. I had loving parents, I had nannies, I was well taken care of, I had everything I want. I don't have any relational trauma. But the truth is, if we start really debriefing, if we really look at the person's challenges in comparison to their development, in comparison to their relationships, we are able to find some connections to how their relationships, their attachment is affecting their current life. It's so fascinating to me. So when it comes to attachment trauma, insecure, disorganized, disrupted, avoidant type of early caregiving relationships could create attachment trauma. Not exclusively, attachment trauma also can be developed at a later stage, maybe after a specific relationship, maybe during school time as an adolescent. And then also another important aspect in terms of trauma is neglect or emotional deprivation. Now, interestingly, like I said earlier, it doesn't matter who it is. Even if the the child or the adult now has had parents who were psychologists, who psychiatrists, maybe even trauma specialists, um, does not necessarily guarantee that the child or that the adult will grow up, the child will grow up to be an adult where there is not necessarily impact from their past in terms of neglect and emotional deprivation. It's so very interesting to really come to think of it. And at this stage, I would also like to remind very often when we talk about attachment, neglect, emotional deprivation, it's directly projected towards our parents. And we need to keep in mind, you are showing up in this session, you are learning about trauma. And trauma science is very new to the world. For an example, CTICC framework was introduced just only last year. ICF is not even using the word trauma informed coaching at this point of time. And even I know of master's degrees, forget about bachelor's degrees. I know of master's degrees, PhDs that focus on applied psychology, applied therapeutic psychology, clinical psychology, counseling psychology, behavioral psychology, and so on. There are some degrees, very well known, very well recognized, top tier institutes, talks about talks nothing about trauma in the entire program. So if it is new to coaching world, you do not have to be concerned. It is absolutely new to the clinical world as well. Now, something important that I must mention is that if it is so new to these structured professions, imagine your parents, most of our parents had no understanding about trauma. It's alien for them. So they did not necessarily know how to take care of us. Therefore, we have ended up experiencing certain challenges and difficulties. So when we talk about trauma, especially attachment, parental related, neglect, emotions related trauma, we are not blaming anyone. We are truly understanding what is available to us. We are seeing the power of knowledge. We are recognizing the power of awareness. And that is why I'm so committed to share this message with you. You might be a educator, you may be a professional coach, you may be a psychotherapist, you might be a principal, you might be a someone working in the UN. You might be a policymaker in the government. I invite you to go beyond just this class and think about how can I bring this knowledge into my world? Maybe it's your personal world, maybe it's your practice, maybe beyond that, maybe to your school culture, maybe to your family culture, maybe to your organization, maybe to your government. If you can do that, I will support you. And you hear that many people want to save the world. Many people expect the governments to save the world, the leaders to save the world, the billionaires to save the world, and someone to rescue. Very often, when people want to save the world, they hope that someone will save the world. Mostly, it's the government that we expect that they have to do something, or a uh, larger power, supreme power, need to emerge to save the world or make the world a peaceful place, something like that. I don't believe in that. I believe in personal power. I believe in not depending on a government or not depending on a billionaire to save the world. I ask myself, how can I save the world in my small possibility capacity? Therefore, I created the CTICC framework. So I invite you to think about how can you make the world a better place? That world one day become peaceful. And that's why we are discussing these topics. I'm not interested in quick gains here. I'm truly so deeply passionate about being here with you, enabling this door of opportunity for you to go beyond of our automatic thinking, unconscious programmed behaviors, so that we can bring about change, so that we do not have to wait someone else to change the world. We, right now in this group, there are 33 people. I think we have so much immense power to create a world that is healing, a saved world, a healed world, let me say like that. We have the power to create that domino effect. So thank you from the bottom of my heart. As I said that there were 34 people. Now there are 34 people in this room. So I invite all of you to take this beyond you. As you apply this to yourself, think about applying it further. There's so much suffering in the world. Every time I speak to all of you, professional coaches, psychotherapists, medical doctors, a common topic that we very often talk about is human suffering. And then, of course, suffering is other beings because of mostly also human beings. So, if you are to end that suffering, create a peaceful world, I think it is very important that we all take actions. And if you want to change the world, if you want to create a peaceful world, start it with yourself. And I think you have already begun. That is why you're in this course. That is why you're a professional coach. That is why, out of your very busy schedule, you showed up. I understand for some of you, it may be 4 a.m., it may be 5 a.m., and maybe some of you, it's 11 p.m., and in between all times. Thank you for being here. Thank you for being part of the larger change that is happening in the world. So continuing on, relational trauma, there's betrayal trauma, right? This I don't even have to explain. Sometimes we lose best friend. Sometimes we break up with a maybe a partner, romantic partner, and then we turn around and say, "Oh, I just dust off and everything is fine. I can numb myself. I can just go for it. I can forget about it. I can put it behind." And we don't recognize that at that time something changed, and at that time, part of our essence was changed. And we became someone slightly different. Our autonomy changed, our sense of self changed. And how we look at our new lover is from that lenses that we had to wear when we went through the betrayal with our previous partner. Abandonment trauma, enmeshment of boundary. Now, I mentioned to you earlier, I remember vividly as a young boy, I must have been 6 or 7 years old. I remember when my mom had her manic episodes, um, I would be getting ready to go to school, maybe around six in the morning. I may be wearing my tie and putting on my uniform. And I have heard many times, I hear this large noise, loud thud, and then something's falling down. And my body will cringe. My body will go into a state of fear, knowing that something is wrong. And it's probably my mother. And and then there's a contradicting thought that comes through saying that you need to support your mother. At that moment, I don't remember where my sister is. I don't remember if my father is around. But there's this contradicting, overwhelming feeling I experience. On one side, immense fear. And on the other side, the feeling of that I need to step in now. I have to support my mother, whatever is going on. So what I'm going to say now is quite graphic. So please take a step back as you hear this. Once I remember rushing into the kitchen and my mom was on the floor, and next to her, there's this big wok, a big saucepan, I could call it, has fallen down with some food spread across the kitchen floor and burning oil. She was frying something, and the burning oil was spread across the floor. And my mom is lying, her head down, her bottom part of her body is in this oil. And it may be so graphic to say, I know the smell of human flesh frying. How unfortunate to say that to you. That I was just 5 years old. So my dad will rush and then take her to hospital. These are my mom's manic episodes based on the story I have been telling you so far. I'm saying this is so much love. I'm saying this is so much gratitude for my mom for her healing journey, how resilient she has become, not from a place of pity, disappointment, anger, or anything like that. I actually cherish these experiences. I am so grateful in a way that I was able to experience those. They enabled me to be here talking to you about them, talking to you about this CTICC framework. It's important to me. So my father has to go to work after dropping my mom to hospital, and she's hospitalized. She was unconscious through the time. So what I would do is after they leave, I'll ask my sister to get ready and I'll help her to regulate and then continue on her preparation. I'd go to kitchen and pick up where my mom left. 5, 6 years old, six maybe, 6, 7 years old. I would continue the rest of the cooking. Did I know the recipes? Was there Google or was there AI? Nothing. There was no such thing. I only could just fix things based on how my tongue experienced the taste because I didn't know any recipe as such. And then I would pack 3 lunch boxes. I will take one lunch box to, I'll give one lunch box to my sister and myself. We'll walk to school first. And then I will take my sister to the classroom and give her lunch. And I can see her, these big eyes, confused. What's happening? Where's mom? I can see all that confusion. And I'm only 6 years old. I don't really even know how to really um, soothe my sister. The only way I knew is to hold her hand, take her to school, bring her to her desk, and then give her her lunch and say, everything will be fine. Everything will be fine. Mom will be back home soon. And then I will carry one of the lunch boxes to the hospital, and I will walk through the hospital corridors, and the nurses and the doctors would know me. It's because they have seen this over and over. So I would bring the food to my mom and I would put it next to her, and she is unconscious. She is in pain and her legs are bandaged, and I can see blood. And yeah, so that's the story. So if you really come to think of it, at a very young age, I had to take responsibility for my family, quite literally. Literally. I had to step in, play the mother's role for my sister, had to play the mother's role for myself. And as a result of all of these things happening in our family, my father's love of life being my mother, he would completely disappear from the picture because it was too painful for him. It was just too painful for him to witness the love of his life is suffering so much. So he might drink alcohol and he might not come home and we wouldn't know where he is. So there were times that I had to take the role of the mother, and there were times that I had to take the role of the father for both myself, my mother, and my sister. So engagement, boundary. So you're noticing that as a child, I had no boundaries. A child with the right boundaries should not hear the mother falling down in the kitchen and all that disaster that I mentioned to you. A child should not have to start preparing breakfast at 6:30 in the morning because your mom is not able to do that for you. And you notice that when those boundaries are crossed, when there are roles that are implied on you, they affect people. Yeah, we call them enmeshment, if not boundary trauma. Let's look at developmental timing. How the developmental timing can also become traumatic. Now imagine pre-verbal trauma. Trauma that happened to a child before the child is able to speak. Something that I very often talk about when we talk about who we are as our sense of self, our ego, or how I came to be who I am. Something that I very often think and feel very scared is this. Imagine yourself. Imagine yourself with all your awareness, everything that you know, all your wisdom. If you were able to be transported back to your body when you were 3 months old, 3 months old, you might have the wisdom, you might have the experience, but you have no language. You have no frame of reference. You have no relational thinking. And you have a body like a pillow. Cannot stand up, cannot talk, cannot walk, cannot change your own clothes. You cannot find your own food. You need to entirely depend on your caregivers, your primary caregivers. Now, imagine being left alone for 20 minutes while you are in distress in a cot as a 3-year-old with all your wisdom, with all your knowledge, with no words, with no way of motor control, with no way of having cognitive, relational cognitive thinking. Imagine the kind of state that you will be in. You probably would feel like you're um, imprisoned in a pillow, a meat pillow. Imagine that. Now, this is someone who has awareness. This is someone who has a wisdom. But now imagine a newborn baby, a toddler. They have no awareness. They have no relational understanding. They don't have pre-verbal, the cognition or ability to speak, ability to do things by themselves. So this kind of trauma, before the language is developed, before the concepts are developed, when they occur, they are usually stored somatically. They are stored in the body rather than the narrative. So our nervous system as a child is already preconditioned or traumatized to begin with. Think about birth trauma. Very often, when you come to think about birth trauma, even the most natural childbirth can be very painful for mother and as well as for the child. Even the most natural childbirth can be very painful. Remember earlier I mentioned very often we think about in the context, like what I said, many coaches, many educators, even physicians, even psychiatrists sometimes are not willing to really in depth learn about trauma, not willing to go beyond the symptoms. Why? Because we are scared. It's understandable, almost like explored territory. Scared means there's fear attached to it, there's stigma attached to it. But if you simply come to think of it, even most of the natural births, giving birth to a child, can be extremely painful, can be extremely challenging, can be extremely traumatic. In that equation, we are forgetting that trauma is part of life. Trauma is human condition. However, the way this earth came to be constructed, be it some kind of a natural order, be it some kind of a natural intelligence, be it some kind of a divinity, be it some kind of a god, doesn't matter. Whichever that intelligence that made this existence possible somehow had a higher knowledge. It knew whatever it is. This knew that somehow trauma is inherent in human condition. Trauma must be inherent in human condition. So let's begin that with the childbirth, come to think of it. So if anyone says that I do not have trauma, or trauma is fearful, trauma is not good, trauma is not serving us, trauma is negative, so trauma is painful, maybe those have certain truths. But if we really look at it from the bigger picture, we are starting to recognize it's not something that we can look away. It's not something that we can say that, oh, I'm a coach, so I don't have to deal with trauma. I'm an educator, I don't want to deal with. No, if you're a human, you are dealing with trauma. With every single breath you take, every single word you utter, you are speaking from a place of conditioned behavior, programmed behavior, and unconscious patterns that are controlling you. And these unconscious patterns, conditioned behaviors, dynamics within you were influenced by challenging, difficult experiences that we have had. It's a universal experience. The more we approach it, the more we talk about it, the more we destigmatize it, the more we learn about it, the more we understand the power of trauma, the meaning of trauma, existential aspects of trauma, and most importantly, learning how to mitigate those trauma, learning how to support, provide care to those who are traumatized, because we know, we understand, and we also understand that trauma can be transformed into something beautiful in itself. Like how that wild cat bitten by the snake, crawling through the forest, getting itself to safety. And in the meantime, a higher intelligence encoded its DNA with this information. Even the shape of a cucumber will get it literally, physically ejected from its place as an involuntary muscle reflex, because it won't it's intertwined with the bigger picture. It's intertwined with love. So welcoming, accepting, recognizing trauma, being educated about trauma, whether it is a government policy, whether it is a school policy, whether it is how you coach, whether it is how you look at your family from an empathetic understanding. Now, when we talk about um, birth trauma, do you know what this is? These are forceps. This is what medical doctors used to use, I think still being used, to pull the child out of mother's reproductive system. And you also know many children are separated from the mother and sent into neonatal intensive care units at the beginning. So even before things begin, there's that separation, a feeling of betrayal, feeling of not receiving love. So our environment, how we I'm not talking about hospital environment. I'm talking about our environment, this planet is actually a hostile one. And that's the way it is. The more we are aware, the more we can mitigate those hostilities, the more we can safeguard ourselves, more we can help those who have been hurt by the hostile universe that we live in. And early childhood trauma, adolescent trauma, I think these topics require a much larger